Bismillahirrahmanirrahim. Now we are going to discuss the anatomy of pituitary gland. The anatomy of endocrine is not much, so a little bit session, 3 or 4 session needed for the anatomy, but the more concern with the physiology actually in the endocrine. So let's see the pituitary gland. So it's a pea size. If you look at the size of the pituitary gland, it's a pea size gland, and it lies in the sella turcica. Sella turcica is actually a word used for the Turkish saddle, and the saddle of a horse where the rider sit. So if you look at the structure, so it's look like a saddle of the horse. So its name came from the Turkish saddle. So that's why we named them the sella turcica. It's actually located in the saphenous bone. So it's a depression in which this pituitary gland lies. So actually it's two parts. One is the interior, one is the posterior, and the infundibulum. This part is the infundibulum. So posterior pituitary and interior pituitary. So this interior pituitary is actually true gland, while the posterior pituitary is the extension of your hypothalamus. So we name them this name, interior pituitary, we name them the adenohypophysis. So adenohypophysis means true gland, and the neurohypophysis you use for the pituitary gland, pituitary, and the adenohypophysis means true gland and true gland pituitary, and the nervous neuro mean it's because the extension of the hypothalamus. So if you look at the interior pituitary, it's at 3 parts: pars tubralis, pars intermedia, and pars distalis. So this major part is the pars distalis, and in between this posterior pituitary and the interior pituitary is the pars intermedia. And the tubralis part, it's like a neck-like, collar-like. So around the infundibulum, collar-like part of the interior pituitary, we name them the pars the tubralis. And if you look at the posterior pituitary, this pars nervosa, and its stalk, the connecting saddle will connect with the hypothalamus, is named the infundibulum. And this depression is actually median eminence of the hypothalamus, which dip down to form the pars nervosa of posterior pituitary. This is the pars nervosa infundibulum connected with the hypothalamus. So this depression is median eminence. So if you look at the location, interiorly uptake chiasm is present, posteriorly a memory body are present. So this is actually your the composed of nervous tissue and the glandular epithelial tissue. So in this picture you can see, so this is actually location of your here is actually your hypothalamus. This is the whole part is the diencephalon. So actually here is your thalamus, hypothalamus, subthalamus, different parts. So our concern with this part, which is hypothalamus. So its extension of, it's connected with the hypothalamus, your pituitary gland. So different part you can see the interior pituitary, pars distalis, intermedia, tubralis, while the pars nervosa, infundibulum, median eminence, and hypothalamus. Any problem?
No.
So this is a sella turcica of your saphenous bone, depression in the saphenous bone. So adenohypophysis for anterior pituitary, neurohypophysis for the posterior pituitary. So if you look at in the skull, you can see middle cranial fossa in its location. Sella turcica actually present right here. So you can see the horse saddle. So if you compare the structure, they look like same. So Turkish saddle. So we uptake interiorly and the memory body posteriorly. The saphenous sinus or body of saphenous is inferiorly, and on the here is your hypothalamus. So this is actually so it is present in the middle cranial fossa. So clinical point is that because this part is actually associated with your cavernous sinus. So where different nerve are present. So if there is a tumor in the pituitary, it may affect the content of your cavernous sinus. So we need to look at the actually cavernous sinus. So another important concept is that when there is a tumor, we want to remove. Instead of we do surgery from upper side to cut the brain and a section of taking a section. It's easier way to read through the nail or transephaneal surgery. So go here and read to this pituitary and remove it. So if there is a tumor, so to remove tumor is the best way. This way. Transephaneal surgery. We name them the transfer to remove this pituitary tumor. So it's easier way. So because here is the justice of instead of, because this is cerebrum, so part of brain, instead of cut down or injury of these part, easier way to read through. Because if you want to point out this point, it move like this and this, where these two fingers meet, it actually position of your this sphenoid sinus where superiorly your pituitary gland is present. So because four sinuses, frontal sinus, ethmoidal sinus, and your sphenoid sinus and maxillary sinus are present. So four sinus you have already studied in the respiratory module. So now see this is actually your cavernous sinus on the side where you find the different arteries. So these are actually showing four sinuses, your frontal, ethmoidal, sphenoidal, and maxillary sinus superior. So if you look at the superiorly in this part, so here is actually diaphragm cilia. Diaphragm cilia is nothing but because if you have little bit idea of the three covering meninges of your brain, so duromater and your rectus mater and pia mater. So one of the duromater, the fold of duromater is actually the diaphragm cilia, which cover your anterior pituitary. So and here is the aperture for the infundibulum to connect with the hypothalamus. So and it is located on the superior margin. And inferiorly, what is present? Your sphenoid sinus is present, and laterally your cavernous sinus is present. So inferior and lateral cavernous sinus. And look at here. So in this picture, so it is actually the meningeal layer of duromater, and this is your endosteal layer, and here is your cavernous sinus. So and this is endothelial lining. So if you look at here, these are what? These are your sphenoid air sinuses, and here is your pituitary gland. If you look at, so this is hypophysis cerebrae, and this is stalk or infundibulum of your hypophysis cerebrae. So this is actually aptachial, which is present on the interior of this. So aptachial, and this part, if you look at, so it is actually coming like this. So this is actually internal carotid artery. So internal carotid artery, same thing. This is same, not too different. So this is actually coming down and coming back. So internal carotid artery. So and these are actually important things. If there is a tumor, it may affect this cavernous sinus and affect these nerves. So these are actually nerves of your eye, oculomotor and trochlear. It's a little bit difficult to memorize them. So easier way to is 3, 4, and the oculomotor and trochlear, and the fifth your trigeminal nerve, and its first two branches, the ophthalmic and maxillary. Mandibular is not present here; it is actually present here. So four nerves on the side of cavernous sinuses. The oculomotor third, fourth, 5, V1 and V2. So only two branches of your because we have three branches of the trigeminal nerve: ophthalmic, the maxillary, and the mandibular. So here concerned with the ophthalmic and the maxillary. So and the mandibular nerve is present just here. So if you look at the other nerve which supplies, because third, fourth, and sixth supplies your eye muscle. So the third and fourth are present here, and your sixth is actually here. So this is actually abducent nerve. So important thing is that if there is tumor, it may affect these internal carotid. If it's affect internal carotid, because internal carotid is going to your brain, so there may be a problem of your brain. So if it's affect these nerves, so which are going to actually supply your eye muscle. So another important is if the tumor, so it actually affects your temporal, bitemporal hemianopia. So because your eye, the light coming from this side, this is temporal side, this is nasal side. If you look at this side, so the light coming from this side goes into the nasal side. The light of temporal side is going to the nasal side. Well, the nasal side is going to the temporal side. So if there is a tumor, so actually when they cross, if you look at the picture of the eye pathway, so when they cross near the optical, so actually, so first they injure this temporal side, because temporal is on the medial aspect, is moving medially. It's medially because temporal is here on the nasal side, on this side. So first they affect the temporal vision. If they further go increase enlargement, so it may affect the both sides, the nasal as well as your temporal. So first bitemporal hemianopia, and later if further increase size of tumor is increased, it may complete loss. So these patients actually present when there is a car accident. Why? Because on this side they do not see what's coming on. So they may problem of the accident, of the car accident, and because of temporal vision is lost. Are you clear?
Yes.
So abducent nerve and the internal carotid. So abducent is associated with your abduction of eye. So abduction of eye may be present. So their eye is moved medially. So if abducent is injured, so this nerve, so you will see is not going laterally, because lateral nerve is the abducent. So important thing is the relation. You can see interior is the optical, and the posterior, which you cannot see in this picture, is memory body, and the superior is the diaphragm cella at this dural board, and inferiorly sphenoid sinuses, and laterally cavernous sinuses present. So these are actually important things. So another important thing is there is a lot of students I've seen, they are confused with their blood supply. We are actually looking at the blood supply. There is a systematic circulation, there is a portal therapy. Have you idea difference between the systematic and the portal circulation?
Portal circulation is a digestive
it's a function, but if structurally, anatomically, if you look at systematic and the portal circulation, let's look at difference between artery, capillaries, veins. This is systematic pathway. If you look at the portal pathway, what is the portal? Systematic, capillary, then a vein, portal vein, then another capillary network. So because here is two capillary network, and then the vein comes. So in between this part is actually your portal vein. So when actually we look at the blood supply of the pituitary, it's a little bit confusing, because both ideas are merging, and interior pituitary supply look like the portal circulation, and your systematic circulation is for your posterior pituitary. So first should be the artery, then the capillary network, portal vein, the second capillary network, then veins. In this pathways, artery, capillary, and the vein. So let's look at the blood supply here. So this is actually artery. In the anterior pituitary, your portal system is applied. So you can see this is your first primary, and this is your portal, and this is your secondary capillary, and this is your vein. So if you look at in this pathway is the systematic circulation, artery, capillary, and the vein. So this is superior hypophyseal artery, which is actually coming from a internal carotid. So here is two plex formation. In this is only the single. So you can easily and hypophyseal vein. So this is your primary, primary capituloplex, and this is your portal vein, and this is your secondary capituloplex, and this is your hypophyseal vein. So it's little bit difficult to understand, but if you have an idea, it's easier. Artery, primary plex, secondary plex connected by the long portal vein, and actually we name them the long portal vein. There is something short portal vein. Short portal vein is actually the other vein, the veins which coming from here and send back the feedback signal. We name them the short portal vein. So this is actually long portal vein, other is the short portal. So are you clear with this? The blood supply of the anterior pituitary and posterior pituitary. So this actually hypophyseal is going to your cavernous sinuses. So it's coming from internal carotid, going back to the cavernous sinuses, this hypophyseal vein. So if you look at another important thing, we see in the anterior pituitary, the connection is the portal. You can see here. So the hormones which are present here, so they enter into primary plex by the portal vein, enter into secondary plex and affect these cells of your anterior pituitary. So let's look at this one of the hormone which will affect this because these are hormones present in the hypothalamus. So they enter and affect. Let's see the picture. Follow the scheme. So they are coming, affecting these cells and cause the release of the hormones from the anterior pituitary. You can see the pathway. So hormones are entering in the primary plex, and via the portal vein affect the secondary plex and then go to the target organ. Are you clear with this? So important, the artery is the superior inferior hypophyseal, superior for the anterior pituitary, inferior for the posterior pituitary, and the vein is the hypophyseal vein which is draining into the cavernous sinuses. Now you can see this is complicated picture. You can see superior is coming, primary plex, and your primary plex is here, and your secondary plex is here, and here is your long portal veins, and these are short portal veins going back. So and here is hypophyseal vein. If you look at the posterior pituitary, here is your short portal vein. So here is your inferior hypophyseal capillary network, and then a hypophyseal vein. So it's little bit complicated as compared to last picture, which was much more simple. Are you clear? So any problem?
No.
So pituitary gland. So this is actually a hypophyseal portal system, and for the posterior pituitary, the connection is the hypothalamo-hypophyseal tract. Actually, so the connection between the posterior pituitary and the hypothalamus is because the hormones are coming from your coming from the hypothalamus, the posterior pituitary are synthesized in the hypothalamus, stored in the posterior pituitary. And while in case of the anterior pituitary, the hormones are synthesized in the anterior pituitary and secreted by also the anterior pituitary, but they are controlled by the releasing factor or inhibiting factor from the hypothalamus. So if you follow the line, so just remember the hypophyseal portal system is for the anterior pituitary, and the posterior is the connection is the hypothalamus, because posterior is the just extension of your hypothalamus, while the anterior pituitary is connected by the portal system. So we name them the vascular connection for the anterior pituitary, for the posterior is the neural connection. Are you good with that? So this is actually a summary table of your all the point. You can read it. So you must need to know the relations and the blood supply, the arteries and veins, and the subdivision, which is the anterior, that is adenohypophyseal, and the posterior pituitary is the neurohypophyseal. Connection is the hypophyseal portal system, while for the posterior pituitary connection is your neural connection or hypothalamo-hypophyseal tract. So here is actually the list of hormones. So anterior pituitary hormones secrete actually simple ways to flat PG. F represent FSH, follicle stimulating hormone, luteinizing hormone, adrenocorticotropic hormone ACTH, thyroid stimulating hormone, and prolactin, and your growth hormone. These are hormones of your anterior pituitary, and the other hormones coming from posterior pituitary are the ADH are vasopressin, and your oxytocin. So these are actually hormones coming. You can see here. So these are actually the hormones coming from your anterior pituitary. You can and going to the target. So TSH controlling the thyroid, ACTH controlling the adrenal cortex, not the granulosa layer. So GFR, so zona fasciculata and the zona reticularis, and the FSH and LH going to the gonads and the testes and ovaries, and growth hormones control throughout the body, your bone length and the muscles, and the prolactin is going to control the mammary gland. So, and your endorphin is other, which is pain receptor in the brain actually. And if you look at the posterior pituitary hormone, the oxytocin and the ADH. So kidney ADH going to control the water balance, and while the oxytocin is prolactin produce the milk and oxytocin out of milk or milk ejection. So you try muscle and mammary gland. So this is all about the anatomy of your pituitary gland. So later on we will see something. Thank you.